Hello, everyone. This is a proposal for our agency Safe Spaces presented by
Rain Marie Aquino.
Madison Jennings and
Michelle Luhau Rebera.
throughout this presentation, we will be discussing the mission, vision, and values, service delivery, legal and ethical issues, community outreach and crisis response, interagency collaboration, and professional advocacy. To address the gap in services within the community of Columbia County, Oregon, we have created the Behavioral Health Housing Program. The populations that have had the most need for these services are the youth, women, LGBTQIA+, duly diagnosed, and clients in mental health crisis. To meet the goal of decreasing housing inequalities, this program will prioritize members of the LGBTQIA+ community that also struggle with mental health and substance use disorders. Our mission statement at Safe Spaces is to create supportive opportunities for community members of Columbia County to heal and thrive in their everyday lives. We provide mental health care, transitional housing opportunities, and addiction and crisis intervention services with understanding, trust, and care to enhance the overall wellness and quality of life of our clients. Our vision statement at Safe Spaces is that we see a future where all Columbia City residents who struggle or have struggled with mental health and/or addiction disorders have a safe place to reside during life's transition or crisis, regardless of their financial position. Safe spaces will fully funded by community and local governmental partners so that our acceptance rate of clients is 100%. We aim to never turn anyone away. Our values. Respect. We are committed to respecting the dignity and welfare of our clients at Safe Spaces by providing a healthy environment with engaged and collaborative care teams. Acceptance. Everyone has the right to compassionate care. Integrity. Operating our facility with integrity and consistency by demonstrating uncompromising ethical conduct in all our actions is key to the success of our clients. Sincerity. Our staff recognizes the challenges our community members have faced, so we practice empathy and compassion to support them through their journey. And last but not least, empowerment. Our clients have a voice and participate in their own care. We intend to raise our clients up so that they can achieve overall wellness and a better quality of life. Our agency consists of outpatient mental health counseling, supportive housing, and addiction crisis intervention services. Services available at Safe Spaces are skill building, which focuses on activities of daily living, supportive housing, which is an inpatient dual diagnosis treatment unit, and addiction services and crisis intervention with the Hopper detoxification service, coordinated, sorry, oh my goodness, I'm so sorry. Can you pause it? Services available at Safe Spaces include skill building, which focuses on activities for daily living, supportive housing, which is an inpatient dual diagnosis treatment, and addiction services and crisis intervention, where we work with Hooper Detoxification Stabilization Center, a 24/7 inpatient care facility for individuals coming off drugs, alcohol, or other substances. We utilize a door-to-door coordinated planning, which helps limit the risk of relapse when transitioning individuals.
Safe Spaces is a nonprofit organization. The state of Oregon defines a nonprofit as one that is either a mutual benefit, public benefit, or religious corporation. Safe Spaces is a public benefit corporation, which means that the articles of incorporation for the agency do stipulate that upon dissolution, the agency's assets will be distributed to another qualifying organization. So that would be another nonprofit organization for either a public or a charitable purpose. Insurance and HIPAA. So in conjunction with the sliding fee scale, Safe Spaces maintains an it's my hour at your hour approach. So with this type of approach, clients do have the option of negotiating a fee for each service that we do provide. That fee is going to be aligned with their hourly wage. And so as with many other mental health agencies, Safe Spaces will accept reimbursement for services via Medicaid and Medicare. That is typically the mode of reimbursement for many mental health agencies. Publicly funded healthcare programs like these provide qualifying individuals, like those with a mental health or substance use disorder, access to needed services. HIPAA, or the Health Insurance Portability and Accountability Act, provides a privacy rule and a security rule. Each of these are outlined by the Department of Health and Human Services. And so Safe Spaces will strive to operate within the guidelines of both the privacy and the security rule. The privacy rule are also known as the standards of privacy of individually identifiable health information. And these establish national standards for protecting certain health information. The security standards for the protection of electronic protected health information, also known as the security rule, establish a national set of standards which protect that health information as it's being held, so stored electronically or transferred. And so the security rule sort of operationalizes the protections which are provided by the privacy rule. So they work together like that, and they address the technical and non-technical safeguards which organizations put in place to ensure the privacy of their clients. And so in alignment with our requirement agency-wide to maintain our clients' protected health information, we do want to touch on record keeping and technology within this presentation because we recognize how prevalent the use of technology is in today's workforce. And so we have outlined 3 steps which we take to ensure client privacy and security. The first of that is that we do logical information security. So as the name indicates, this requires very sort of basic common sense steps to provide security for our clients. These include passwords, identification codes, limited menus, user profiles. It can also include things like auto delete and auto edit of electronically stored information. Additionally, Safe Spaces intends to provide biannual security checks, which will review all safety concerns and address those expediently. And then finally, we will provide an annual policy review. So we are dedicated to ensuring that we have policy focused on telehealth services and focused on electronic communication, electronic storage of records. So Safe Spaces will review each of these policies annually, and so the goal of that is quality improvement within the program. Okay. Our ethical standards. Safe Spaces strives to maintain the highest ethical standards at all levels of the agency. And so within that, we want to ensure that we are providing our staff training on how to meet up to these ethical standards. In accordance with the Oregon administrative rules, staff are required to receive at least 16 hours of pre-service training and 8 hours of annual training. And so the topics included for this type of training would be severe persistent mental health disorders, substance use disorders, trauma-informed care, building cultural competency, things along those lines. Oregon has adopted the American Counseling Association's 2014 Code of Ethics statewide. And so in alignment with that Code of Ethics, Safe Spaces counselors will receive ongoing supervision and will have supervisors available to support their trainees in client consultation. In Oregon, the standard is 2 hours per month for qualified mental health associates and qualified mental health professionals. So the distinction there is that the mental health associate is a bachelor's level mental health professional, and then the qualified mental health professional is actually a master's level provider. And so on top of those two designations, if one attains a licensed professional counselor, a license as a professional counselor, the Oregon Board of Licensed Professional Counselors and Therapists requires 2 hours of supervision monthly. And so the stipulation there is that the supervision is required to last at least 1 hour per session, and the 2 sessions cannot fall within the same week of a month. Okay, so as we touched on earlier, Safe Spaces does provide a sliding fee scale. Glassburn reports that sliding fee scales are used by socially competent counselors and organizations, and so we want to ensure that we are meeting that expectation. Staff at Safe Spaces will set aside at least 4 hours per month to see clients free of charge. And so that allows us to provide the pro bono services that we have described previously. And any individual that is needing services that is at or below the poverty line will be asked to pay only a nominal fee, akin to a very low copay at each visit. Clients with income that is 100 to 150% at or above the poverty line will receive a 75% discount for each service that they receive. And clients that are that have an income of 150% to 200% at or above the poverty line will receive a 50% discount at each visit. So all of this is on top of our at our hour service. So it's my hour at your hour approach. Okay, Safe Spaces is committed to engaging the community in mental health care. And so in accordance with that, we want to provide advocacy events on an ongoing basis for individuals in our community. We intend to provide advocacy events and fundraisers, and in doing so, we're providing a monthly support group. And so with that, we want to ensure that we're able to connect people and provide resources sort of on a monthly ongoing basis. And in fact, the National Alliance on Mental Illness, also known as NAMI, indicates that through a strategic alliance with NAMI, we might be able to host the monthly support group for underprivileged individuals in the community. And having that partnership would allow us to provide additional support and resources. And on top of that, we want to provide an annual advocacy workshop. And so this sort of is in the vein of a conference with a series of discussions and presentations on preventative mental health care measures. And so Ilardi indicated that there are 6 components of preventative healthcare measures that one can take to stave off mood disorders. These include movement and exercise, nutrition, vitamin D, engagement in the community, healthy sleep habits, and the use of mindfulness techniques. So each of these sessions would work on promoting some preventative mental health care measure.
So as a culturally competent member of the community, the Safe Spaces Agency is also trained in crisis response and community emergencies. So in Oregon, one of the most destructive natural disasters that is very common, unfortunately, is wildfires. And that's according to the Oregon Housing and Community Services. So what we decided to do at Safe Spaces is to support the community by providing recovery counseling. And not just that, but we're going to team up with FEMA to provide free crisis counseling for those affected by wildfires. So we teamed up with the Oregon Housing and Community Services to be a part of the action plan for RE-Oregon. As you can see, RE-Oregon is an initiative to recover, rebuild, and revitalize after being affected by wildfires. And this provides equitable access to resources necessary for fire-impacted individuals and households. Our staff here at Safe Spaces is also going to be trained to meet needs of mental health counseling and crisis response and skill building and all of the services we provide for clients of all ages. That's an important assessment that we have to make on a yearly basis to make sure that we are not leaving a gap in the population that we are serving in Columbia County. So we decided that, we would focus on children, then adolescents, young adults, and then older adults, and respond to their individual needs for that age group. So for example, children, they experience a wide range of mental health concerns. Screening from pediatricians may facilitate early intervention. That's according to Beckman and his colleagues. They reported that in children, there was an increased risk of suicide, poor judgment, psychosis, and dangerous behavior toward themselves or others predicted later psychiatric hospitalization. So our focus here is early intervention. For adolescents, our research shows that adolescents are more impacted by trauma than their older counterparts. So adolescents may be more susceptible than adults to acquiring post-traumatic stress disorder, or commonly known as PTSD, as a result of exposure to traumatic events, according to Fletcher. So we know here at Safe Spaces that we can do trauma-informed crisis care at the core of services for adolescents, and specifically dealing with anxiety and intrusive images, which would be helped by eye movement desensitization and reprocessing, or EMDR. For younger adults, the concern is behavior on the computer. So I know that sounds very simple, but basically this is our plan to incorporate computer-based risk assessments. So 29-year-olds actually report using social media 78% more than older age groups, according to Ilakuvan. Sorry about that. And they are averaging over 3 hours daily. So an important qualification for adulthood, according to Broderick and Blewett, is to include accepting responsibility for your own actions and making independent decisions. We felt that went hand in hand with computer-based risk assessments, so that they allow clients to gain some feelings of control as they can make informed decision following these assessments. The services are offered by community-based intervention wherever the client is for older adults. So that is basically our mobile crisis team. So it's wherever the client is, because we know that older adults sometimes have mobility issues or challenges. And so such as at work or at home, and they're not necessarily restricted to days and times. So it's not a rigid, in other words, the mobile crisis team is not like a rigid by appointment kind of system, but rather we come to you and whatever you need. So for competent mental health counseling and just service providing in general, it is essential to team up with interdisciplinary partnerships at all levels of our services provided. Here we outline, for example, starting kind of with outpatient clinical mental health counseling. So that would be commonly known as, like you can imagine, like a therapy session, right, with a counselor and a client. And so in this regard, the consult we would make would be the client's general practitioner. And that is because general practitioners are crucial in the recognition and eventual treatment of depression, according to Hines. In other words, when individuals have any health concerns, their first stop is their GP, their general practitioner. A lot of the times that's because people who are experiencing mood disorders for the first time in their experience, they present more with somatic symptoms, like which we know now that are actually psychosomatic symptoms, so physical symptoms. And so they go straight to their primary care provider. And so consulting with the client's general practitioners is going to allow us to plan care effectively and responsibly by having all the knowledge about how the client presents. For our supportive housing program, our consult is the local Department of Corrections. So just to be clear, the supportive housing program is designed to provide either a step down from more intrusive levels of care. So like, for example, incarceration or residential care, or a step up from living independently if that is what the client needs. Accordingly, Safe Spaces will work to foster strong working relationships with individuals from the local Department of Corrections. And so Safe Spaces team members, when they work collaboratively, providing case management and housing placement services, which align with this agency's mission to enhance the overall wellness and quality of life of our clients. When we do that in consulting with the Department of Corrections, we can better be placed in a situation where we can better serve our clients. Also, for our addiction and crisis intervention services, our consult is a local detox center. So it's called the Hooper Detoxification Stabilization Center, as Madison was mentioning earlier. So the Hooper Center is, like she said, a 24/7 inpatient care facility. So typically when an individual has an addiction crisis, immediate medical care is necessary. And so that is where they go first. And this is typically like a week's worth a stay, like 7 to 10 days to detox and kind of help the individual through the dopamine lows. But after those 7 to 10 days of rehabilitation are over, then we provide a door-to-door coordinated planning that helps limit the risk of relapse when transitioning individuals. So if you can imagine, a patient comes out of the Hooper Detoxification Stabilization Center, and we provide the transportation means necessary to get to either our supportive housing residential program or wherever they need to go. As a community-minded organization, especially a nonprofit organization, Safe Spaces also includes strong advocacy efforts, which we already mentioned. So I'm only going to briefly go over our competencies. So Safe Spaces follows the ACA's advocacy competencies to guide and help facilitate how we work with clients in the community. So our strategy here is identify what need there is in the community or where there's a gap, like we did when we were creating the agency, then strategize how to best address it, and then execute, whatever needs to be addressed, whether it's a fundraiser or an advocacy event, or as Rain Marie was mentioning earlier, like a preventative measure workshop that we do annually. So thank you so much. Here are references, and we hope you enjoyed this presentation.